I'm David Musnick, and I'm a sports medicine doctor and a functional medicine doctor. I've been practicing functional medicine for a long time, at least 26 years. I'm one of the sort of people that used to teach it, and I evolved with it. In other words, did a lot of the planning of what the test requirements were and all that. Um, and then I have my sports medicine practice. So two big fields: orthopedic sports medicine, regenerative medicine, and all this functional medicine stuff. And oftentimes they interrelate. That's what I found was interesting, is that there's a nice connection between those things. About 2007, I started learning about something called frequency-specific microcurrent. And earlier than that, I heard about microcurrent. But in 1996, I heard about lasers. So started learning about different things that could help the body, that were not drugs, that weren't supplements, that were actually what we call either modalities or devices or external treatment. And I became very interested in how they worked, why they worked, what they could work, and what they could work for, um, what all the possibilities were. And I wanted to be what you call discriminating, meaning I wanted to make sure that if anything either I bought to use for patients, that it works, that it was effective, that it was reasonable in price, and that it didn't cause side effects. That makes sense. Um, so went through a lot of trial and error with different things, and so as we get into this, what you learn is there's an electromagnetic spectrum on planet Earth. I don't know about other planets, because although I'm totally into Star Trek, I've never, gone on the Enterprise to explore other planets, because I probably would have really liked the role of the Star Trek doctor. But, on Star Trek, they they have all this stuff. They have all they can scan you and figure out what's wrong. I think that's called a tricorder. And then they have all these devices that they use. I don't know if you remember any episodes, someone broke their bone, and then the doctor's like getting that the bone is fixed. 5 minutes with this device. I mean, they have all kinds of devices, and of course, they never say a lot about what these devices do. So, um, we can be healed by things, and let me explain what healed means. The body is trying to heal itself, but what I found is the body often cannot do that. And let's say, and sometimes it doesn't matter what supplements you give it, because that can always help. But sometimes when you give it supplements, the body still is not healing tissue. Like it's not healing an enlarged liver, it's not healing a fatty liver, it's not healing the brain, it's not healing the blood-brain barrier, it's not healing leaky guts. So many things can happen, both in the musculoskeletal system, as well as in the internal systems, as well as in the brain, where the body stops healing. Does that make sense? And so oftentimes my patients might say, well, why aren't I healing? And that's a really big question. Why aren't I healing? What's going on? What could be blocking that? What could be stopping that? Um, and there's huge lists, Well, you could have Lyme and nobody knows it. And we need to find out, because I found that in so many people, that they actually have Lyme disease and they didn't know it and nobody thought of it. And we have to heal that. They could have chronic viruses. Um, they could have mold biotoxins. Now a lot of people know about mold biotoxins, but not as many people know about these chronic viruses or the long COVID, or what the long COVID is doing to people, because it's doing more than anybody imagined it's doing. I talked to a doctor in New York City recently who's really into energy medicine and what this long COVID thing and the COVID vaccine is doing to people. But even if you didn't get the vaccine, what the long COVID is, I could not believe what she's been finding. I thought I knew it all. And then I heard what she's saying. It's actually transmitting prions. Prions are these things that nobody wants, that people heard about years ago causing this degenerative dementia in people. And I thought the only time people could get a prion was from infected cows. And there's a type of disease called Crutchfield-Jakob disease. And apparently now she found through different methods that there are prions in almost everybody that she's tested now, that she needs to do some things to neutralize this and whatever. So I've now got a nice contact and connection. And I'm going to do some checking this out and send her a saliva test and then do what she says to tell me to do. But anyway, so there's so many reasons why people may not be healing. You know, there's the spike protein. I know about that now. Toxins and so many things. That did you know that in autoimmune diseases, the immune system often can't remember self-tissue, like, oh, this is my intestine, this is my this is my that, because there's so many toxins that, you know, if you're looking at somebody going, I wonder if I recognize them, and they start out looking like, you know, a friend that you had 10 years ago, but you haven't seen them recently, but now they look so differently because of all the toxins that we're being exposed to, that the immune system says, oh, I don't know who you are. You might be the small intestine, you might be the liver, but you look so different. I'm going to send a message to this other part of the immune system, and then I think we're going to develop antibodies to go after you. And that's one of the biggest reasons now why people aren't healing with autoimmune diseases, because of the toxins and the mold. And now the biggest theory on autoimmune diseases is that there's chronic infections that are relating to why people have these things. And the body still has the chronic infection, it's not healing. So I became interested in the concept of external healing, meaning applying a device to somebody to get something to actually heal when it stopped healing. And some of the most important places for this are tendons that stop healing, and they get tendonitis, and it keeps going on and on and on. And the pain processing system in the body, which consists of, say, if it's your low back, there's receptors here, there's stuff going on in your spinal cord. And did you know that in chronic pain, spinal cord actually remodels and changes to be a very sensitive system? And then the brain remodels and changes in a place called the thalamus, and then we perceive pain much more and it hurts more. That's going on in fibromyalgia. It's also going on in any kind of pain that's gone on for more than 2 to 3 months. That needs to be healed because it's not healing on its own. Then we have these barriers in the body that are not functioning well, like leaky gut is a barrier. So many people have it. So many times functional medicine practitioners check it and then put someone on a program, but they don't recheck it 5-6 months later to find out, did it really heal? And that's part of my policy. And whenever I teach the stuff about leaky gut, you have got to check it again when you institute a treatment program, because if it didn't heal, you've got to do something to promote healing. And I was always amazed how many patients I've seen that had a positive leaky gut test that, you know, 3, 4, 5 years ago. And I said, did the doctor or PA or anybody recheck it? We go, no, I didn't know I needed to do that. I just thought I needed to take these things for 6 weeks or 8 weeks. Then we recheck that, and they've got rip-roaring leaky gut still going on with all these antibodies and problems. Or someone had the blood-brain barrier compromised for some reason, and now there's all this information that all these neurological problems start in the brain from a leaky blood-brain barrier. Early dementia, all kinds of things. And the people that have leaky gut can also have a leaky blood-brain barrier, because the same junctional proteins that are down here are up here that line the whole brain. And so that needs to be healed in people that have that. And then I found in anybody with cognitive issues, where they trouble remembering things, trouble finding words, trouble with organization, trouble with focus, all these, you know, cognitive things that can happen to people. And you don't have to be old to have it happen. I'm seeing people in their 30s that this stuff is happening to. That actually needs to be healed. You know, new connections need to develop between these neurons. And then we need actual healing in the brain. So, and I have patients with liver issues where they come in, their liver's down to here. They don't have hepatitis. They had fatty liver. And because of the way they were eating or the blood sugar regulation or whatever, the liver swelled up, got really inflamed, got big. The liver doc said, well, we're going to watch this, And so one of my patients actually had the guts to ask the liver, well, what are you watching? Well, we're going to watch until you might need a liver transplant. Now, I don't know about you, but I don't want a liver transplant. I don't want anybody to have one. And getting a liver transplant is an iffy thing because, first of all, it's like a horrible operation. You're on immunosuppressants, and it almost never goes really well. And you want to heal your liver, and you want people to heal their liver. You don't want to wait for a liver transplant. So situations like that, I've actually integrated different types of energy medicine because homeopathy is actually energy medicine. The use of dilute substances is actually energy medicine. I don't know if you know that, but it's not really just related to the electromagnetic spectrum. So if we look at the electromagnetic spectrum, we get light at different frequencies, and then we got infrared. So you can't really see infrared, but infrared sort of heat things without you seeing it. You've heard of infrared saunas? With infrared, it penetrates deeper. It's a wavelength of light that has healing abilities. And what's really interesting about that type of energy is it's incredible to penetrate deeper in the body and get toxins out. We sweat out a lot of toxins. They've done studies where they actually measure what's in the sweat. And there's a lot of toxic substances coming out in our sweat, which is just good to get out of our body. So infrared and that type of heat and sun is a very good like energy medicine type of thing, which has a direct effect of getting toxins out of the body. That's an example. We have light therapies, LED lights you can see. I have a laser in one of the rooms there that I use for healing primarily necks and nerves and other things. But what laser is focused, concentrated light that isn't just like this light. Like this white light is part of the electromagnetic spectrum, but it diffuses. In other words, it's not a focused beam. So have you ever seen, you have a laser pen? If I had a laser pen, I could shine a dot in a corner up there. And the only reason you could see the dot is because it's coherent. It's focused, as opposed to if I turn a flashlight on here, you're not going to see it up there. It's diffusing all over the place. So in terms of light therapies, that would be energy medicine. We have coherent light, which are lasers, and non-coherent light, which are LEDs. Then we have infrared light, which is like really used a lot in regard to penetration. And then there is some light therapy where you go in there in a bathing suit and you expose your skin to the actual light. Did you know that plants have parts of themselves that make chlorophyll, right? So plants are really interesting because they can convert sunlight into food. We can't do that. You go out in the sun, you can't create food, but we can absorb light and create energy, believe it or not. So we have parts of ourselves that can absorb actual light and create ATP, the energy molecule, that we actually have cells and enzyme systems that respond to, but only certain frequencies of light, not like, okay, put a flashlight on yourself. That won't work. Only certain frequencies. So when I was deciding years ago what kind of laser to get, I wanted a laser that didn't just decrease pain. I wanted a laser that had those frequencies of light that actually healed, because I didn't just want to decrease pain. I got to heal the tissues too. So in 2007, I was going to a functional medicine meeting, and I was going to give a talk to about 500 doctors on what was called the structure part of the functional medicine matrix. The functional medicine also has a philosophy, and they had something called the matrix that had nothing to do with the movie. And the matrix had to do with how the body was thought to function in relationship to the most important systems or approaches. So I was given the task of teaching about structure, like, the musculoskeletal structures, the structures of all the tissues in the body, and how to maintain the most healthy structures. So I was given a talk on that, and including focusing on, okay, let's give an example of structure, like how do we rebuild bone in osteoporosis? And how do we take a functional medicine approach to that? And then how do we keep structure healthy with exercise, and what's the right exercise prescription? So I was going to give a talk. And it was in Baltimore, and I had flown from Seattle, that's where I'm from, and I couldn't move my neck in the morning, like zero motion. And I thought, okay, this got to be from the plane, like forward head posture, and then the pillow in the hotel. So I am walking this way, and this is how I discovered microcurrents. So it's a very cool story. I'm like trying to get to the lecture hall. I want to see where I'm going to give a talk, because most people, when they're going to give a talk to a lot of people, you're a little anxious. Okay, where am I going to give the talk? So I'm walking like this. I can't move my neck. And over there was the exhibit hall. This doctor who was at the microcurrent exhibit called out to me, "Hey, Dr. Musnick, how are you? Aren't you going to give a big talk?" She was over here. I didn't know who she was. He knew who I was, apparently. So I thought, oh, that's cool. I'm well known enough for her to know who I am when I don't know who she is. So I went like this, because she said, "How are you?" So I went like this. "I'm fine. How are you?" "Yes, you are not fine. You didn't even move your neck." I go, "Yeah, you're right. My neck can't move my neck. Really bad." And I didn't know what she did. I didn't know what microcurrent was. I didn't know anything about it. So then she goes, "How long has your neck been like this?" I said, really, just since the flight in the like, wasn't like this before I got on the plane." She goes, "Do you want me to fix it?" I go, "What do you mean fix it?" She goes, "Do you want me to heal it?" I said, "What do you mean heal it?" At the time, I didn't even, like, the word heal. I'm a healer now. I'm not just a doctor. I consider myself partly a healer, not a shaman, but I do really good work with people and get to what they need to get to. But at the time, the word heal was foreign to me, like, healing? Okay. So she goes, "Okay, well, you're giving a talk in an hour. Do you have 45 minutes?" I go, "Yes." So "Why don't you lie down on the table?" She works with the microcurrent, not this unit, because in those days, the unit was this big. It's called the blue box. It was huge. All the dial. I still have it. So if you ever get any microcurrent and you're not in the room with the blue box, you can say, "Could I please see the blue box?" I always wanted to see the blue box, because it's very impressive with all the dials, every setting you can do. And so at the end of the treatment, she says, "Okay, why don't you get up, see how you're doing?" I had full range of motion. I was like, "Oh my gosh, I have full range of motion." And I just, looked at her and said, "Thank you so much." She goes, "Yeah, come back to our booth and check this out." I went and gave a talk, forgot all about that booth, what she did, just was, glad I could move. Next year came around, 2008. The same thing happened, only to my lower back. My lower back. And then I knew who she was. "Hey, Dr. Martha, how you doing?" And at that point, I wasn't an idiot anymore. It's like, my lower back is in horrible shape. She goes, "Oh, let me guess, the plane and the hotel bed." "Yes, come on over here." And I literally, I couldn't do any of this. Get off the table. "What just happened?" "I got full range of motion." "Okay, what is this?" "It's frequency-specific microcurrent. This is the second time I have healed you. What is it going to take for you to come back to my booth?" I said, "I will come back to your booth." I will. So then I went back to the booth. This was in like the winter of 2008, and started learning about what it was. Okay. And that it was a 2-channel microcurrent system. I learned where it was on the electromagnetic field. It's microamperage. So it's not PEMF, because PEMF, a lot of people have heard about it. They think it's the best thing since sliced tofu. Now I say sliced sourdough bread without any gluten, because I've now discovered that even though I need to be gluten-free, if the sourdough bread is really whatever they do with it, I can eat it, right? Or I think I can eat it. So it's a 2-channel microcurrent system. Micro means a million. It turns out that the cells in the body work on certain frequencies and energy levels at a millionth of an amp. And an amp is a measurement of energy. And the way they communicate with each other and the way they function is literally at a millionth of an amp. So when people are, why the microcurrent? Because that's the exact way that these cells function on an energetic fashion. And we are bioelectric human beings. If a doctor just treats us as we only respond to pharmacology, that's not true. We respond to energy too. You respond to all kinds of things. Someone says to you, "How are you?" And they look at you and they care, that you respond to that, right? That's a different thing. That's an emotional thing. It's a mental thing, but we respond to energy and the right energy. And it has to be the right energy. Because remember, I told you with laser light, if not the right wavelength, you won't have a healing response to it or whatever. But in terms of microcurrent, we respond to a micro amp. But the frequencies that we respond to have to be correct and the right frequencies for us to heal the tissue. So channel 1 on this unit, and I'm going to tell you something, that this unit is now as good or better than the one that was, the original blue box that I bought was $14,000 and it couldn't run programs. And I'll tell you what a program is. It couldn't run it. You got to set the dials and the cords come out of it. I mean, it looks really official. And I use it sometimes for somebody who doesn't, I don't believe in this stuff. Okay, let me crank this up until you feel that. Do you feel that? Yes, I do. Okay, maybe I'll believe in it now. I don't do that anymore to people. I talk to them about this and why and how it can work and tell them about all the success stories, because I've now treated thousands and thousands of people with almost every condition on planet Earth with this thing that at least is appropriate for it. But over time, they needed, units that could both run channel 1 and channel 2 frequencies and whole programs of that to treat certain things and conditions and tissues and whatever, without having to be there and every 3 minutes change it. Because I used to have to sit in front of these things and go, okay, now I'm going to change channel 1. Now I'm going to change channel 2. I had to be there the whole time, which was difficult. But I used to have to do that until we had the units that function almost like a computer, that without any electromagnetic fields. I will tell you that there are no electromagnetic fields coming through these things. But now they can run themselves. In other words, automatic programs. When the doctors, me, designs the programs to treat whatever it is I'm treating, can turn it on, apply it to the person, and not have to change everything every 3 minutes. So what are channel 1 conditions? So these units are programmed to be able to put the channel 1 condition in and have a channel 2 tissue. So let me start out with the tissues first, because that's very interesting. The frequencies have been found out to be very specific to the tissues. So like 396 is the tissue for nerves, but not the spinal cord, just the peripheral nerves. And 90 is the frequency for the forebrain, part of the brain. 89 is the frequency for the midbrain, and 94 is the frequency for the medulla that controls so much of our nervous system. And then the liver, I think, is 33. But anyway, there are frequencies that have been found out for all of the important tissues in the body, including the heart, including arteries and capillaries. There's a different frequency for capillaries than arteries. So if you think about channel 2 frequencies, are the tissues. Now it's interesting. Someone was here the other day because she had nerve pain. She had seen 3 providers, and I hear this all the time. I always saw 3 doctors. I always saw 3 this, whatever, and I'm in pain. Nobody knew what I had, or they said, you got this. He goes, I don't think I have this, or whatever they're doing isn't working. I hear this all the time because doctors need to be like Sherlock Holmes and sleuth it out and figure out every aspect of what are all the tissues that are the problem? What are the conditions of these tissues? How does this system relate to that system? How's the mind-body working with all this? What's your attitude about it? And why aren't you healing? And let's come up with a complete plan now, looking at all that stuff. Anyway, so I figured out she had horrible pain here, down here, and everybody looked at her and thought they had to massage it out. And every time she got a massage, she got worse. So I checked her out and found out she didn't have any muscle problems at all. She had cervical 6, 7, cervical 5, 6 completely inflamed in her neck. And it was leading to a referred pain pattern down here. And she also had pain like from here to here. And she had a cervical 6 nerve irritation. And that's why she wasn't getting better. And she wasn't healing because nobody addressed any of this. And everybody saw her as like a massage therapist, a myofascial person, a Rossiter person, or whatever. Because you won't believe how many different variations of these hands-on things there are. And for most of the people that do it, if it's tight, they mash on it. But it's like, that's not the point. It's like, if it hurts, you got to figure out what tissues are these that are generating the pain. Is it not only something you think is right there? Could it be something referring to pain? Because in this case, these joints lead to pain down here. And they found this out when these medical students were injected with hypertonic saline like 40 years ago in medical school, had to subject themselves to this. And they mapped out the referred pain patterns from these joints. And even a lot of doctors don't know this stuff, but I know it because I've been teaching this to other doctors for years, so I better know it. I have every map of anything in the body that's ever been written about what can cause pain and from what structures. So then, after I evaluated her, she said, how can I get better? I'm having this horrible pain. I said, well, first of all, we have to have something to heal these really inflamed, sensitized joint capsules. Number one. And number two, we have to heal the nerve. And she goes, I believe in healing. I said, I do too. And she said, well, is there anything that I could take to heal the nerve? I said, I don't really want anything you could take to heal the nerve. Really. But I do have a method of energy medicine called frequency-specific microcurrent that can heal the nerve. And she was like, I'm all over that. I'm fine with that. Because her job is she's like a hypnotherapist. So she's like, okay, we can heal the nerve and we can also heal the joint inflammation and the pain coming from these tissues. She goes, how can you do that? I have now seen 4 massage type therapists, and every time I go, I get worse. I didn't say, well, why do you keep going? I keep getting worse. Because she was about to have a Rossiter treatment. I don't know if you know what that is. She said they walk on you or something. I said, don't do it. Don't do that, please. Because she told me a story how she was in Peru recently and she had somebody else do some deep, deep tissue. She said it was like meat on a bone or something. And she got much worse. So how can I get worse from something like that? I said, because you don't have any muscles in dysfunction. You don't need anybody to loosen them up. You have some tight muscles because they're actually guarding the area. And if anybody worked on this and loosened up the muscles, you're going to be in big doo-doos. And your muscles are trying to keep your neck in alignment or keep your neck out of compressing this nerve. And then someone works on those and they go haywire. That's why you're getting worse. You go, oh boy. Okay. So then what I did to treat her with, I had already written a bunch of programs to treat nerves. But this is a special nerve. It's the nerve root in the neck. So I needed a special set of channel 1, channel 2 frequencies, all listed, that would treat the nerve root in the neck. And I needed a whole different set of frequency sequences to treat the joint capsules and heal them. And in one session, although this isn't necessarily common, she went from like an 8 out of 10 to like a 3 out of 10. So I got her in on Wednesday, but even one treatment, she's better. And she texted me, thank you for the first session of healing. And I hadn't thought of it as healing, but that's what I talked about. I said, you need external healing. Because your body can do certain things that if we sometimes need to jumpstart healing. When we're looking for, when we're looking for what will do these things healing wise, sometimes the body just stops. It just stops healing. And what's also very interesting is the body has a system of inflammation and cells that cause inflammation. And it's actually a functional system to repair things. But after a certain point, if you keep having inflammation, that's not functional. Does that make sense? not helpful. It's not functional. Number one. So inflammation that keeps going needs to be stopped. It needs to be appropriate and balanced. Not everything needs to be stopped. Some things need to be balanced. Things need to be modulated. And then things need to be healed when they are not healing. Like if there's pressure on a nerve root, it needs to be healed. The nerve actually needs to be healed, especially if it's not healing. And so there's so many reasons why our tissues will either stop healing or can't heal. And it doesn't matter what religion you are. And, I'm Christian and like, I believe in healing, but it's interesting. I had talked with the main pastor at my church and then we had a men's conference and this pastor came in from Oklahoma that was unbelievably inspirational. So much positive energy. I couldn't believe it. But he said, yeah, we believe in healing in this church, but we also believe that that's not going to happen all the time. And that, and I can't tell you how many times, like I've walked in a room and someone said, God said to me that you're going to help me as part of my healing. I go, I am honored because I take those referrals. Right. So it's like, it doesn't matter what your religion is or what you believe, like we need help. Our bodies need help at different ways. Okay. So if someone said to me, Dr. you do regenerative medicine, you do platelet rich plasma, you do laser, you do pulse magnetic field, you do the highest level of functional medicine of almost anybody on planet Earth because you taught it, you've evolved with it, you designed the test. And what is one thing that we can't take away from you that helps you the most to help people heal? It's this. Not just the device, but to do it. Okay, it's the frequency-specific microcurrent. The reason it's called specific, not just microcurrent, is because it's got specific tissues on channel 2 and specific conditions on channel 1. In order to do my healing work, I need a 2-channel system. You don't want to ever get a treatment that's actually going to expose you to adverse electromagnetic fields, right? That's why, like, when someone's in one of my treatment rooms getting this treatment, I say, turn your cell phone into airplane mode or something, but you can't have it right there because I don't want it to counter anything while it's happening. And it probably isn't, but still, it's like your cell phones are doing this stuff all the time. And then people are come in with these headphones that nothing's connected. I say, you can't wear that while we're treating your brain. You're damaging your brain. So 2-channel microcurrent system. There are the most practitioners of frequency-specific microcurrent than any other type of electromagnetic field modality or energy modality of anything on planet Earth. In other words, there's thousands of people around the world that are collecting research that when we go to the advanced meetings every year in Chandler, Arizona, we share the research about how we helped heal this, and how we helped heal that. And often, like, I am amazed what people are doing. They're amazed with what I'm doing. Because when you take these courses, and I teach some of them, one of the things you hear is expect a miracle. Now, I have never heard that in a medical course. They don't talk about miracle. They say, expect a miracle. If it happens, you're going to be thankful, but don't, think you can't accomplish something if you think you can. Like this woman's liver that was down to here, 40 years old, it's normal now. And she said, that's it. 6 treatments and your supplements and the homeopathy and this, it's normal. The liver doctor said your liver will continue to get bigger. It's going to firm up. It's going to scar and you're going to need a transplant. So she says, I have a mind to go in and meet with the liver doctor and feel my liver is back to normal. The liver enzymes are back to normal. I don't even have fatty liver anymore. So she did it. And the guy goes, that's impossible. It was down to here. I documented it's up to here. I'm like, what did you do? She told me, oh, that's woo-woo. She goes, you can call it woo-woo, doctor, but it healed my liver. And if all you want someone to do is be on the liver transplant list, you better refer to this doctor and people doing this because this works. And you need to open up your mind. So luckily that person didn't say anything mean to her. So 2-channel microcurrent system, it's only as good as the knowledge of the practitioner. So there are very few practitioners in this valley. When I was in the Bellevue, Washington area, I was the most experienced person in the state of Washington. Then when I moved here, I was the most experienced person in the state of Idaho. So the treatment's only as good as the knowledge of the person doing it in regards to them figuring out what is every tissue being affected by what you got going on. I mean, every tissue. So remember the gal I told you about, there's this weird pain here? Did I have to treat her muscle like everybody was doing? No. Everybody was doing it. It wasn't working. I had to treat her joint capsule in her joint, in her neck, flowing the microcurrent from the positive lead to the negative lead. There's always a microcurrent lead on the back side and the front side of the body. Positive lead always on the back side, negative lead on the front side. And I had to treat the joint capsule tissues, and I had to treat nerve tissues. And one of the most interesting things about frequency-specific microcurrent is we also treat the nervous system. No matter what we do, we're treating the liver, we treat the nervous system to the liver. That's why we're doing a lot of vagus nerve treatment. The vagus nerve controls all these internal organs. So with a lot of things, if I'm treating leaky gut, if I'm treating the liver, if I'm treating someone with a heart issue, you can calm down coronary inflammation. Did you know the most serious thing going on in everybody's heart artery is inflammation of the coronaries? I can treat that, which is amazing. So we have to have a 2-channel system. We have to identify every single tissue related to it. We have to figure out the condition. What's the condition? It could be arthritic. It could be inflamed. It could be infected with Lyme. What's the condition of these tissues? There's fat in the fatty liver. And then it could be fibrotic. Do you know a lot of people have fibrotic scarring changes in the lungs since COVID? I've got a frequency for fibrosis and scarring. A lot of people actually have adhesion in here from, surgeries. And we have a frequency for adhesion. And what's amazing is years ago, there was a surgeon that wanted to find out if microcurrent worked on scar tissue, and if so, how? So they had a whole video in this surgery with microcurrent on the patient during a sterile surgery. They found these adhesions from, in the pelvis and in other places of the abdomen. They found when they turned the microcurrent on with the frequency 13 and then used the frequencies where the scar was going to, you could see, I saw this video, I couldn't believe it. Guys going like this, receding, going bye-bye. Wow. That was about 9 years ago. I saw this at one of the advanced scenes. That's amazing. So they proved that 13 works. But if scarring's even worse, it goes into what's called fibrosis. Did you know that some scars, they get even worse and they get fibrotic? That's the frequency 51. Did you know if it gets even worse, it calcifies? That's the frequency 91. So we have to know all the conditions so we can put those conditions into a computer program and light up. You might have 7 conditions with just the nerve, and then 7 conditions or 5 conditions with the spinal cord, 4 conditions with the vagus nerve, whatever it is, and have to know how to do it with a reasonable amount of time, because you have to know all the tissues that need to be treated. Did you know that there's almost no situation when your body needs to heal that there's only one tissue involved? That if it's a nerve, there's also the sheath of the nerve. There's the spinal cord that is it's like the parent of the nerve. The nerve comes out of the spinal cord. You often have to treat the spinal cord. Remember I told you people with chronic pain, the spinal cord actually changes. So I have to have methods to get the spinal cord back to normal over time, which before I knew this, there was no way to do it. I knew no way to do it. And now this can do it. So when someone has a condition, I'm also always considering whether frequency-specific microcurrent might be appropriate, whether laser might be appropriate. I've determined in many situations that pulse magnetic field is not appropriate, but most of the time when they're promoting pulse magnetic field mats and this and that, they say they're the best thing since sliced bread. They're 1-channel systems. They work at a very narrow set of frequencies. And so every time one of my friends are calling, what do you think about the biomat or the this or that? Let me look into it. And then I say, and it was funny because recently I was in Boulder, Colorado, And this gal that went to the microcurrent meetings with her, she goes, I bought this mat. I like it. I'm not sure what it does, but I like it. I lie on it. I go, okay, I want to feel this mat. I couldn't feel any coils. I said, she goes, what do you think? I go, well, I haven't tried the mat, but I can't actually feel any coils in the mat. Like pulse magnetic field mats have to have coils in them to generate the magnetic field. So I said, what are you trying to accomplish with this? He goes, well, I'm trying to actually accomplish what frequency-specific microcurrent does, but I just want to be able to lie on a mat. Say, you can't accomplish this because it's a one-channel system, and it may or may not even have coils in it. But anyway, so with this type of treatment, I can set different parameters on this, like the strength of it. If someone doesn't work out, the strength is 100 microamps. If they work out, we go up to 150 or more. And now what I do, which is interesting, is I've learned techniques of manual release techniques to go along with this, because one of the originators of this particular equipment now teaches the whole system of manual work to go through the body that goes with this, which is fascinating. So we have to figure out, where's the positive lead going? It always goes on the back of the body, but where does it go? Does it go behind the liver for the liver? Yeah, it always has to go higher. And then the negative lead goes to the front of the body, lower than the organ or the nerve or whatever. So the placement of these things is really important. We don't put them right on a person's body. We put them in a moist, warm towel, because we found when we do that, it conducts better. They receive the frequencies better, although you can do it with electrode patches. But when we put it in a moist, warm towel, treat it like a spa treatment, they lie down on the table. Oh, conduction is so much better, because I can actually see through this how much conduction is getting through. And then I have to choose the program I'm going to use, because remember I said a program is lines of frequencies: condition frequency, tissue frequency, how many minutes I want. Do I want it alternating up and down? Do I want it polarized? Did you know the nervous system does better for most people polarized? So I got to set all those parameters. Do I want it on gentle or medium or sharp? And that I do when I do the programs. So sometimes I have seen patients where I did not have a program yet to solve their problem. And this is where that sort of term helps. Always have hope, expect a miracle. Give an example. A father and mother bring in this 18-month-old toddler. She was born without an esophagus, literally. They said, you're our last resort. I go, okay, I don't see that many babies and toddlers, and because I don't necessarily like hearing you're my last resort, but I've heard it so much. I said, okay, what's going on? Well, they rebuilt her an esophagus. They built her an esophagus. I'm not going to give you the details how they did it, but she keeps closing it off, and they have to keep dilating it. And so it's like, then when she closes it off, she starts vomiting, and we're like about to lose our kid. And we don't know what else to do. So we heard about frequency-specific microcurrent. Can you help us? I go, okay. Then I go, how many cases of this have you treated? Like, wait, how many cases have I treated of a baby? Because I don't see babies. Most of my patients are at least 4 years old, because I also have a specialty in the brain. Anybody gets concussion, I do a lot of ortho stuff. I do functional medicine with anybody maybe 6 years of age or older, because of all the experience I've got. But I said, okay, look, I haven't seen a case of this. I'm going to be honest. Okay. But you know what? I'm willing to try. They go, what does that mean? I said, I am willing to design a program to treat this condition based on the channel 1 and the channel 2 frequencies to keep that esophagus open, so this kid can eat and drink and survive. So I did it. Went to the computers. Oh my gosh, did it. They have brought this kid in like 6 times. So I designed a program to keep her esophagus open based on some frequencies related to scarring and trauma and allergy and other condition frequencies. And they have come back now and say, my kid able to drink, eat, and isn't vomiting because of this therapy. There was nothing else. You know, I could have said, oh, this is like daunting, but I said, I'll take it on. Um, I've been able to do that with many different things where I actually had never encountered it before when I was thinking about, okay, what are the tissues? What are the issues? What are the conditions? I can treat that, or I have frequencies for that or whatever. And I also integrate another type of energy medicine with most things I do called the homeopathy, and I find they're more powerful together. Um, so there are, so I now on my unit have 580 programs. Each one of these is different. I can treat everything in the brain, all aspects of the brain, the blood-brain barrier. I've brought people back from cognitive decline where the husband didn't even recognize the wife. I'm not saying that's always possible, but I have brought people back from that. And I always say, you want to get a better brain? We need some external healing along with the supplements and the brain diet or whatever that I designed to do it. I can treat virtually any tissue in the body for whatever condition it has, except for cancer. I will not treat cancer with microcurrent. I will treat the side effects of the treatment, whatever. But one of the teachings in microcurrent is you can't use it to heal cancer. We don't know how to do that yet with microcurrent, but you can treat a lot of other aspects of it. Treat any kind of pain or problem in the musculoskeletal orthopedic system and save people from most surgeries. Not all. I can treat inflammation, arthritis, treat all kinds of nerve issues. Very good for nerve issues. I can get the vagus nerve working again. Can treat all kinds of gut issues. What I found what was interesting is all kinds of small intestinal bacterial overgrowth, irritable bowel, constipation was related to nervous system issues or other issues related to abnormal cell signaling. The other interesting thing is, did you know that, have you ever heard this, that a lot of conditions are related to low energy and the mitochondria not functioning well? It's one of the central reasons why things don't heal or don't function or start going. And did you know that cancer, the biggest theory right now why people develop cancer, it's called the metabolic theory of cancer, is that tissues stop generating ATP normally. And then the body goes into what's called a metabolic failure, where cancer cells use sugar and what's called anaerobic metabolism, and they multiply. Whoa, you want that? No, I don't want that either. So one of the things that's been found with the frequency-specific microcurrent, it increases the ATP five times. No matter what frequencies you're running, which is fascinating. People always say, I have better energy. And I actually have designed some free programs just to treat the mitochondria or to get people out of what's called the cell danger response. Because I forgot to tell you this, one of the reasons why people don't get better is what's called the cell danger response. They're locked into it. And if you have an active infection, the body's trying to defend itself. It may shut down the mitochondria to some degree. We can treat that now with this. So, how many treatments do people need? It just depends on the issue, the condition, and I try to be honest with people about how many they're going to need for what type of thing and what else we're going to need. Because I don't usually just use this in isolation. I use it with other functional medicine things, supplements, homeopathy, whatever. Are there side effects? Almost never. One of the only side effects is people get so relaxed they want to take a nap. If I ever treat myself, if I'm lying down, I'm taking it. But not always. When we use it here, we either provide ocean sounds or very hopeful piano music, because I want people to feel hope at the same time they're doing it. And I always tell people, I'm going to tell you whether I can heal this with this or not. I'll tell you how many sessions. I'll tell you what else we might need to do. Is there a guarantee? No, but it's like because I've had so much experience, if I tell someone I can get this done, I usually can. You know, I had a woman the other day with 55, barely move her neck, 45 degrees. So much arthritis in the neck and inflammation, a lot of neck pain, and then, thumb pain. But I said, yep, we can get the inflammation out of your neck. I won't be able to use it completely to get all your range of motion back. We're going to have to, maybe have some PT or chiropractic for that. But she had rope-like spasms that were so bad in her neck. So you're not going to a chiropractor now. They won't even be able to move you. we're going to use this to get these muscles to go back to normal tone without applying massage to it, because she already tried that. It made her worse. And then we're going to disinflame these joints, and then you can go to chiropractic and we'll work concurrently like that. Like I said, the vagus nerve can be involved with a lot of things internally, whether it's the heart, the lung. I can use it on so many things like the lungs, the sinuses, almost any internal organ to get it better. And almost nobody has any side effect. Almost nobody. It's like the only time I've seen side effects is if someone has Lyme disease, they don't know it. Sometimes Lyme gets aggravated by any type of external thing you do to it. So sometimes they, oh, well, sorry you got aggravated. Let's run a test for Lyme now and let's really find out if you have it or not. But in general, it can be used for so many things in the body. And the reason why there aren't that many people doing it is in order to actually learn how to do this, a person has to take a 40-hour course. That means 5 days of 8 hours a day, intensive study, and then invest in the equipment, and then go through what I went through, which is a learning curve that was like this. And when I learned it in 2009, it wasn't very easy. And a lot of people took the courses and stopped using it because they couldn't figure out how to design the programs. That back then, we didn't know everything we know now about what it actually did. We didn't know that you have to treat the brain in almost every condition. We didn't even know how to treat the vagus nerve back then. We didn't know that 124, which is a regeneration frequency that we know about now, we didn't even know it was time dependent. So we only ran it for 2 minutes instead of 40. We didn't know that 49, which is the vitality frequency, could be used for longer periods of time and revitalize almost any structure in the body. So back then, I'm glad I stuck with this. And the nice thing is I have access to the person who wrote the book. There's a couple books that have been written. This one's called Frequency-Specific Microcurrent and Pain Management. This actually goes into how it works in terms of the tissues and the resonance, this whole concept of resonance in the body. And then there's a book called Resonance, written by Dr. McMakin, that isn't like so medical. It's more kind of a good read about frequencies that heal. And so there's 2 books right now about it. There is a website called Frequency-Specific with the research articles on it.